I think there are both clinical signs from what a patient is feeling and then signs that we want to look at in their diagnostic testing, as well as elements of their medical history which may lead us to suspect that ATTR amyloidosis may be what the patient is presenting with. So if we go into the clinical signs and symptoms of heart failure, fatigue, shortness of breath, difficulty doing things without feeling exhausted, worsening fluid congestion, cough, lack of energy. In terms of other red flags that we may be seeing outside of just the symptoms, if we're looking at a patient's echocardiogram, which is an ultrasound of their heart, if they have an abnormal amount of thickness of the heart, that leads me to the suspicion that this could be the diagnosis. When we're looking at the electrocardiogram, sometimes the size of the voltage of the leads in electrocardiogram is much smaller. In terms of other elements of red flags, we also are seeing certain lab biomarkers, such as natriuretic peptides, which are abnormally elevated, and other symptoms that are not related to the heart that I always ask for. If they're having nerve pains down their legs, if they've had joint replacement before, if they've had carpal tunnel disease, these are things that we want to try to assess outside of their cardiovascular complaints as to whether or not this could be one unified diagnosis.
Indication and important safety information. Indication. Attruby, acoramidis, is indicated for the treatment of cardiomyopathy, of wild-type or variant transthyretin-mediated amyloidosis, ATTR-CM, in adults, to reduce cardiovascular death and cardiovascular-related hospitalization. Important safety information. Adverse reactions. Diarrhea 11.6% versus 7.6%, and upper abdominal pain 5.5% versus 1.4% were reported in patients treated with Attruby versus placebo, respectively. The majority of these adverse reactions were mild and resolved without drug discontinuation. Discontinuation rates due to adverse events were similar between patients treated with Attruby versus placebo, 9.3% and 8.5%, respectively. Laboratory tests. Mean increase in serum creatinine of 0.2 and 0.0 milligrams per deciliter, and a mean decrease in eGFR of 8.2 and 0.7 milliliters per minute per 1.73 square meters was observed in the adults with ATTR-CM treated with Attruby versus placebo, respectively, at day 28 and then stabilized. These changes were reversible after treatment discontinuation. Use in specific populations. Pregnancy and lactation. There are no data on the use of Attruby in pregnant women. Animal data have not shown developmental risk associated with the use of Attruby in pregnancy. There are no available data on the presence of Attruby in either human or animal milk, or the effects of the drug on the breastfed infant or maternal milk production. Please see full prescribing information for Attruby at attruby.com/PI.